I see patients that have congenital heart disease. We follow them throughout their life, both prior to surgery if we feel that's necessary, and then after surgery. So they'll have their surgery at the Rush Hospital, and then I will continue to follow them outpatient in the clinic. I also see patients where pediatricians may have a concern that there's a problem with the heart. So let's say they hear heart murmur, or the patient passes out or is having chest pain. I can evaluate them in the office for any type of heart defect. I chose to go into pediatric cardiology because I was born with congenital heart disease. I had complex cyanotic congenital heart disease. I had my open heart surgery when I was 15 months old. I sort of know what patients are sort of feeling, what they're experiencing on the inside when they feel about a chest pain, when they feel like they're going to pass out, when their heart feels like it's beating funny. We can repair holes in the heart, we can replace valves without actually needing open heart surgery. We don't need to cut through the chest anymore. We can simply do a cath procedure to place a new valve, to put in a device to close a hole. And so that's been very exciting over the past couple of years. You're never fully repaired, and you always need to continue to follow with a congenital heart specialist. And at that point, if additional surgeries are needed, you continue to give them expectant management as far as what things do we see down the line in someone that had this defect, and how do we continue to care for that, and what we need to do for that in the future.